Scoliosis and spondylolisthesis. What are the key differences? So I recently was asked to explain what the difference is between scoliosis and spondylolisthesis. All right, so the spinal column. We have lumbar, we have thoracic, we have the cervical. The This little model here does a pretty good job of showing what the lumbar curve is. So we have a natural curvature in our lumbar. And then as we get to our thoracic, the curve goes a little posterior. And the cervical spine on this model is a little straight, but typically there is a little kind of curve here in the neck, very similar to the lumbar. So we have this sort of tailbone, we have a lumbar curve, the thoracic curve, and then we have the cervical curve. And that's the natural curves of the spine. The spinal column, again, this is a pretty good representation, but there's a little bit of it's not exactly how our necks are. However, the spinal column is not meant to be straight up and down vertical. There's these natural curves in the spine. So then, well, what is scoliosis? Scoliosis is when we have a curve in the spine that is bending to either one side, and then in this case, I'm going to try hold my little skeleton, and then maybe a little bend over to the other side. So the bends are working more on this direction, side to side, as opposed to anterior and posterior. We have a curve going laterally. And so when we have the spinal column going forward, that's called flexion. When we have the spinal column going backward, that's called extension. And when we side body bend, that's called lateral flexion. So that is what scoliosis is. Spondylolisthesis is when a vertebra actually becomes misaligned off of this like classic curvy structure, and it slips or slides often forward or back, but gravitational movement and the way the spine is designed, typically in the lumbar spine, the vertebra will slide forward. It is possible to have a spondylolisthesis anywhere along the chain. Where I've seen a lot of it occur is in the lumbar. Some of us are the lucky few that have both spondylolisthesis and some scoliosis. And it is what it is. So what we have to do is learn to work with it. But these are two terms that until you've studied anatomy or looked at anatomy or attempted to understand, can be very confusing. So you probably saw on the thumbnail for this video, it said scoliosis versus spondy. Sometimes there's a shortened term for spondylolisthesis is spondy. And that is referencing the slide or the slip movement of the vertebra in a direction where it gets misaligned off of the entire spine. So how does this show up? Well, actually, let me back up. One of the big questions then is like, well, how does it happen? And there's a lot of different reasons for both spondylolisthesis and scoliosis. Sometimes it's genetic, so we can look at x-rays or MRIs of our parents and our grandparents and even our children, and we'll see similarities in the curves. Scoliosis, it can be hereditary, even spondylolisthesis. That is one way that it can be. The other is due to imbalance, muscular imbalance that happens through repetitive exercise motion or just movement patterns. For example, if I just always wear a backpack on one shoulder, so if I stand here with attempting vertical alignment, you might notice that my right shoulder is down a little lower than my left shoulder. So I have some scoliosis in my spine. And interestingly enough, though, I wore a backpack when all through elementary, middle, and high school. And still, unfortunately, no, I try to be conscious of it, but I always wore my backpack on my one shoulder. I always had it on my right shoulder. I never put it on my left shoulder. I never did. So there's a chance I developed scoliosis due to wearing a really heavy book bag throughout my growing up. So it can happen due to repetitive motion or how we align. And then in terms of spondylolisthesis, it also can be hereditary. So we do see that parents, grandparents, and children might have the same situation going on, which would allude to hereditary, but also injury, impact, and wearing down of the vertebral discs. And then you have a hard fall or just good old fashioned gravity. The disc just tends to slide forward. And so both of these can actually produce quite a bit of pain. All right, so now we're in the world of yoga. You might even, maybe you're watching and not really a yoga practitioner, but you're involved in movement, and you may or may not be aware if you have scoliosis or spondylolisthesis. One thing I notice, I tend to come across scoliosis a lot more than I do spondylolisthesis from just working in the field. And how the scoliosis typically will appear or present itself is that one hip will be hiked up a little higher than the other, which will cause one side postural muscles to be tighter than the other. So one side will be a little shorter than the other. And the same thing can occur in the upper spine, where we'll have like a curve where there's a little bit more of tightness on one side, which causes a lengthening on the other. And it can often present as back pain. So if you have back pain, there's a potentiality that you have a little curvature in your spine. The other thing I like to remind people, though, is that this is completely natural. Like if you go out into nature and you look at trees and you study the trunks of trees, and you'll notice that some are very few are like look or appear to be totally straight, but often you're going to see little kinks and bends and turns, and every tree is going to be a little bit different. So I believe it's completely natural to have a little bit of misalignment in the spinal column. No one gets a chance to live this perfect life where we never experience any injury or gravitational pressure or have to work a job that causes us to do something always just one-sided the whole time. So that's where yoga comes into play, where we do this practice of attempting to align the body similar on both sides. And what's really cool about practicing yoga where we are doing symmetrical activity or attempting to balance sides of the body is that then these anomalies will appear, and we'll start noticing, like when I do Janu Shirshasana, for example. Well, all right, let me point out, if I have a little bit of scoliosis in my kind of lower thoracic spine, that then when I go to bend forward, in this case, I'm going to end up stretching a muscle down here called the QL, the quadratus lumborum. Now, if I have scoliosis where my right side is really tight and my left side is long, that when I go into Janu Shirshasana and I bend my right knee and I try to square off my body to go forward, that as I try to go forward, it's difficult for me to actually maneuver the spinal column all the way over because of that over tightness on one side. But then when I go to try the other side and you bend your left knee, well, this would be the side that's a little longer. I find it's really easy for me to touch my right foot because of the way the spine is curved. So then the next question is, though, but is the ability to touch the foot really easy on this side versus my ability to not touch my foot on this side? Is that due to scoliosis, or is that due to tight hamstrings and one side is a little tighter than the other? And then the world really opens up, because the next question can be, is it a combination of both? And what came first, the scoliosis and then the tight hamstrings, or the tight hamstrings cause the scoliosis? Well, good luck trying to answer all these questions, because I mean, we have a lifetime of factors that are coming into play. So in my opinion, our solution is let's work with what we have. Let's use intelligence and anatomical study to help us to now figure out a successful course forward, and then to also develop a sense of patience. I'm not going to completely realign my spinal column in one day. It might even be a course of 10 years where I start to see some shift or change. The other issue that I think is important to address is that let me just try to utilize my yoga practice as a way of dealing with the discomfort that I feel through the tightness that is happening on one side of the body or other, to help just make this moment here now feel a little bit more comfortable or easy. So these are some of the concepts that I want you to wrap your head around. And one really good way to start to find out about this is get an x-ray. So if you go to a chiropractor then can, if you go to a good chiropractor that has x-ray equipment, they can do an analysis of your spine. People that are really good body workers that understand alignment and use things like having you stand up against the wall and charts, we can start to map out, one shoulder is one height, then we turn to the side and they start to see different movement patterns that happen with the spine. And we can see just basically looking at the body and watching the way walking movements are done, very close introspection of what the body does in movement. So it is possible to observe this through movement. It's possible to observe it through imaging technology such as X-ray and MRI. And then the other key is to work with somebody who knows what they're doing. How do you find somebody that knows what they're doing? You got to do your research, and you got to look around, and you got to ask questions. Ask lots of questions. These are all important aspects. So I hope that I answered your questions, or some of your questions, about scoliosis and spondylolisthesis. I'm learning more every single day as I work with my own body and as I work and help facilitate working with other folks. So if you're watching this video live, remember you can comment live and I can answer questions live. If you're watching this video on the replay, remember you can leave a comment there and I will answer you via the comments and the questions there. Help me hit 2,000 subscribers on YouTube. It's great. It helps us out with our channel. We really appreciate it. And visit us at nativeyogacenter.com. All right. Remember, no matter what we're working or dealing with, there is a solution, and we can make choices that can direct us toward improved health and wellness. I hope you have a wonderful day. Namaste.